Away from Parliament, project coordinator of the Mental Health Society of Ghana, Esinamdra, has said the COVID-19 is the now leading cause of mental health disorders in Ghana. She further explains frontline workers are even at a higher risk of developing mental health disorders as a result of their continuous contact with patients infected with the virus.
In the past year, the COVID-19 pandemic has become one of the leading causes of mental health conditions, partly due to the disease experience, social distancing, stigma, discrimination, and job losses. In Ghana, which is one of the countries that have been affected by the pandemic, healthcare workers, patients with COVID-19, children, women, youth, and the elderly are experiencing post-traumatic stress disorders, anxiety, increased levels of depression, distress, insomnia, suicidal tendencies, and high rates of substance use disorders, among others. In Ghana, evidence suggests that even frontline healthcare workers who were directly involved in the collection of samples, diagnosis, treatment, and care of patients during the outbreak are also at higher risk of developing psychological distress and mental health symptoms. Anxiety, distress, depression, fear, and
Meanwhile, COVID-19 Project Officer for the Ghana Federation of Disability Organization, Christopher Agbega, says persons with disabilities are being gravely affected by the virus. In an interview with Joinis, he tells us depression is the most common mental health effect of the virus on persons with disabilities.
Depression has been the major psychosocial complication that has arisen due to the virus or the pandemic. And depression doesn't just happen. It happens when, there is fear, there is anxiety, there are, some sort of, these kinds of complications that arise from uncertainties. Because we live in a time where this pandemic has really brought out a lot of uncertainties. We don't even know, a lot of persons with disabilities don't even know how long they can deal with living with these PPs or adhering to these laid down protocols, the loss of family, or the loss of their jobs. And so depression has been the main thing. We've had some people who also with already existing mental health complications have had heightened levels of it. Last year, and I think it is still in the airwaves, that hydroxychloroquine is the drug that cures the virus. But you see, amongst persons with autoimmune condition, hydroxychloroquine is a medication that they take daily. So last year, when it was said that this particular medication actually heals you from the virus, and the pharmacies increased the prices, you can imagine the complication it had amongst persons with autoimmune and neurological conditions, because this is medication they take daily. So there's an amount of money they even have to struggle to get to buy these medications. What then do they do?